Hi, my name is Andrew. I'm an F1 doctor working in Derbyshire. I'm currently working on a stroke medicine rotation and I've just completed MaxFax, which is oral maxillofacial surgery rotation. In terms of what I found most enjoyable or most engaging, I think this partly comes from what I personally have discovered I like, but also what I personally discovered I don't really like. So, talking from my experience on max fax surgery, it's a very senior led speciality. And what I'd find was that in the morning, the senior doctors would come and do their wards round, and then they'd go off to surgery or to clinics and basically leave me on the ward to take care of patients, which is a good skill to have, but at the times it felt quite isolating and a little bit lonely. And compared to where I'm at the moment, stroke is a very much team oriented specialty. So what I've discovered is that having that kind of like camaraderie and kind of like speaking with other team members, having that little bit of banter, having that freedom to ask questions to the members of the team when I need it, which is fairly often, is something that's really valuable to me, but also really enjoyable, engaging. So I think in terms of what I enjoy, I definitely like the more team specialities rather than the solo led specialities. So I'm discovering new challenges every single day. But the most current challenge that I'm experiencing, and it's definitely a welcome challenge, but a challenge nonetheless, and that's having to treat patients with lots of complex medical conditions, comorbidities. So at the moment, I'm working on the stroke ward, and all of our patients have had a stroke of some sort, but there's no such thing as just having a simple stroke. On top of that, they might have a combination of other uh, diseases, comorbidities, kind of like health issues, and it's a very cerebral specialty. I'm always thinking, but also it can be quite draining at times. So that's when I kind of like I do have to rely on my colleagues. I do have to rely on my seniors for advice and input. So that coming from a very relatively simple surgical specialty where it's bring the patient in, get them into surgery, then get them home as soon as possible. Dealing with patients who have very complex medical conditions is definitely a lot more of a challenge. But as I say, I think it's a positive challenge. I'm really enjoying it. I'd say it's definitely the people that work in the NHS. So I'm surprised by people's level of compassion and willingness to help you and willingness to help the patient and go beyond. But also, it's a little bit of a double edged sword. I'm equally surprised by NHS workers that don't engage well with staff, that don't engage well with patients. So I think in any kind of workplace, you'll encounter both kinds of people, but it's very much kind of like a double edged kind of like a duality that seems to be quite unique in the NHS. You've got people that are really willing to learn and to learn, to work with you, to get to know you. And then there are others that work in the NHS that don't want to have anything to do with you, don't want to be burdened, don't want any additional work, or kind of like groan at the side of you when you have a question. So I think that's what surprised me most about the NHS, really, just how that it can attract two kind of like people at opposite ends of the spectrum. But it's quite entertaining to find out what kind of person you are when working in this system, because there are times where I found like I definitely wanted to go above and beyond, but also times where I just want to be left down with get along with my work. So I can definitely empathize with both, but I think it's important, for the sake of workplace camaraderie, that you've got to try and put your best self forward and not default to being a bit of a grumpy person that doesn't want to do anything with any other people. So I think I could talk about my support system as kind of like a physical presence that's helped me, but also just some kind of like mindset changes that I've also made to benefit me. So when I was applying for foundation jobs, I knew after spending many years in London, I wanted to return home to Derbyshire to spend time with my family and also to save money. But also having that support system built in when you move into a new job is really important because it's one less stress to deal with on top of the mountain of stresses that you get from moving to a new place of work, and everything associated with that. So I think it was a really smart, well, not smart, but wise decision retrospect to definitely move back home. Not everyone wants to do it, and there are definitely cons for moving back in with your family. But for this first year of foundation anyway, I think it was definitely the wisest thing for me to do. So in terms of mindset, it's a bit of a weird transition going from a medical student to a doctor. When you're a med student, you're used to or conditioned to having doctors being forthcoming with teaching and guidance. But when you become a doctor, suddenly it's like a switch is being flipped, and nobody automatically or very rarely gives you guidance or teaching without you asking for it. So that was the biggest kind of like surprise to me in some ways, because I'm still relatively junior. I'm only just starting out. I have loads of questions. My subject knowledge is still quite sparse in some areas, especially when it comes to these very senior-led specialities that I'm working in. And what I found that is, if you don't ask, you don't get. So you really have to be an advocate for your own learning here. You have to kind of interrupt the consultant in a wards round and say, can I ask why you're choosing to do that, not this? Or could you explain why you're choosing that dose instead of, and so on, basically. And most of the time, the consultants or the senior doctors are very happy to talk you through it. There are times where, you know, they are secretly wishing you hadn't asked that. They're rolling their eyes a little bit, or they're getting a little bit impatient. But even so, you have to continue to ask these questions, because if you don't ask, you're not going to learn. And if you're not going to learn, then the foundation program is very much just a service provision program. So unfortunately, you do have to be your biggest advocate when it comes to your learning professional development. But I think from my experience so far, the majority of people I've counted are very happy to teach you. You've just got to be the person to make the first step and ask for that help. So again, when I was going back to choosing my foundation jobs, having that support system, having family close by, having that sense of familiarity was really important to me. So I actually chose a job that is based at the same hospital for 2 years, which was a deliberate strategic decision of mine, but I think is something that's definitely best for me. So having that continuity from F1 to F2 will be really helpful. Otherwise, if you're moving to a new hospital, you're uprooting your life, you're moving to a new workplace with a different culture, with a set of, different logistical systems like electronic systems, it can be a real nightmare, and it can be a real drain on your well-being. So thankfully, I'm in the same hospital for 2 years. In terms of what comes next, I'm moving on to clinical oncology, which is another medical specialty, which, similar to stroke right now, I've heard is quite busy, but I think it's very intellectually stimulating, and I think that's actually what I quite like. I like these specialties, these medical specialties that force you to think rather than just following a set of guidelines. And I think that's kind of like what shaped me so far as a doctor. I can definitely see myself being more of a medical doctor than a surgical doctor, for example. So in terms of what comes next, I'm moving on to clinical oncology, and then I'm back in F2 with a little bit of a stint in GP, coming back to the same hospital to do trauma orthopedics and palliative care. I think when you start off as a doctor, everything seems a little bit terrifying until you do it at least once. So, for example, I'm entering my set of night shifts, and I am quite scared about it. I'm quite anxious. I've heard a lot of things to be scared about, but I think, as I've found so far, this is just you and your anxiety of the unknown kind of like just working yourself up. And I think when you do something at least once, you kind of like take a moment to reflect and realize it's really not as terrible as you expected. Or even if it is quite bad, you have some knowledge about what to expect going in the next time. And that in itself is really valuable, because you just learn to get on with it, really, rather than spending all this time worrying and ruminating and using up that extra energy.